Hi, welcome back to our NCLEX live review sessions here at UWorld. Thank you guys for joining us today. Today we're going to be going over the psychosocial integrity questions from the NCLEX-PN's test plan. So for those of you who don't know me, my name is Holly. I am one of the content developers here at UWorld. I am a nurse. I also work in the CVICU, and I'm joined today by my colleague, Holly.
So as Holly said, my name is also Holly. I'm also a nursing content developer at UWorld, and I have a background in pediatric psychiatry, and I'm currently studying for my primary mental health nurse practitioner.
So as a reminder, please keep your video quality at least 720p or higher. We want to make sure nothing's blurry on your screen. You can read. We've got everything zoomed in for you. And like last week, we're going to give you guys some time between the questions, between questions and after we read the options for you to answer in the chat. So in the single best, we'll have a poll for our select all that apply. We will let you just free response. We did hear you. We've got 3 select all that apply for you today and 1 single best, so that will be awesome. And again, we'll be answering questions at the end of the stream about the items we went over specifically, but also just your general questions that you have nursing-wise. So we're going to try to teach you a lot about psychosocial integrity, mental health, all of that, and we hope it will be things you can carry over. And we'll give you some study tips. And with that, I'll let Holly tell you a little bit about psychosocial integrity.
Yeah, so like we said, we're talking about psychosocial integrity today. This topic is covered about 6 to 12% of the NCLEX exam. And so within this topic, we'll talk about how to handle clients dealing with stressful situations, along with dealing with clients who are suffering from mental illness, either acute or chronic, and some other things in between.
Yeah. So we are going to go ahead and get started in just a minute with our question. And so here we go.
Okay, so for our first question here, we are going to look at the question stem. The question stem is this area right here. It's the main question that's being asked, and then it's followed by answer choices, which are sorted alphabetically. So with this question stem, we want to see what it's asking us. So for this question, we're exploring more about safety and how to promote a therapeutic environment for the client. We're looking at a client who's experiencing active suicidal ideation and which interventions would be appropriate for this client. So a test-taking tip is when you're answering select all that apply questions, start with question answer choices at the bottom and then go up. So starting at 5 and then going up to 1. Sometimes with doing this, it helps to slow you down as you're reading through the question in order to better answer it. So we'll give you a little bit of time right now to think about how you would answer this question.
All right, so it looks like we've got some answers coming in. You guys can go ahead and submit those if you'd like, just free response in the chat. It looks like our top choices, we've got 5, 3, and 1. Okay. Hey guys, we are having just a little bit of issues with our sound here, so we're going to pause for just a second while we get that sorted out. So hang tight with us, and we'll be back in just a minute.
So thank you for answering in the chat, and we were able to read your responses, and now let's see if you guys were correct. So it looks like we answered right here. If you put 1, 2, 3, and 5, you were correct. Next, we're going to look at our table. This table will give us a good picture of what to look for in a client who is suicidal and things that are important to pay attention to. So for a suicide risk assessment, it's important to evaluate for ideation, a method, plan, and intent. Suicidal ideation is thoughts of wishing to kill oneself. A method is the method that they might have chosen to use. Plans, which is steps that might have been taken in order to fulfill this plan. And intent is how strong the thoughts have been. So it's really important to question which of these things the client has when they're experiencing suicidal ideation, as a client with active suicidal ideation needs to be hospitalized for their safety. So like we talked about, conducting a suicide risk assessment, which includes directly asking the client about details of their suicidal ideation, is important. Sometimes nurses feel like they have to shirk away from asking clients direct questions about their suicidal ideation, as it may feel awkward, or thoughts about possibly introducing ideas into the client's head. However, this is not the case, and for safety, it's very important to see just what type of thoughts the client is experiencing in order to be able to figure out what level of care that they need. Next, performing mouth checks to ensure the client has swallowed their pills is important, so that way we can see if the client has a risk of possibly hoarding medication in an attempt to overdose. Assigning staff to continuously observe the client is important in order to be able to have someone have eyes on the client and make sure that they're not participating in any harmful behaviors. And then ensuring that the client does not have access to items that could be used for harm, such as necklaces, shoelaces, extra bed sheets. This is really important, especially when caring for clients on a medical surgical unit or intensive care unit, places that aren't equipped for safety, as like, let's say, an inpatient psychiatric unit would be. And also, if you are assigned as a sitter to a client, it's very important to pay attention to them, because sometimes harm can happen quickly, and so it's important to be vigilant in caring for them. Discharging a client who has active suicidal ideation home with for psychotherapy or anything like that is not an appropriate intervention, as the client right now is in an unstable state and cannot keep themselves safe. So it's important to place them somewhere where they can be observed. So our educational objective, we found, is, again, when caring for a client with active suicidal ideation, we should conduct a risk assessment, perform mouth checks during medication administration, place them in one-to-one observation, and then remove items that could be used for harm. And so we found on the test plan, the NCLEX-PN test plan, that this is covered in psychosocial integrity. And also something else that we can do to help prepare is we can add this to our notebook, and so we can highlight the educational objective, and we can place it here. Let's make a new one here. So we're going to title it Mental Health. Oops. And we're going to place it here. There we go. So that way we can have all our mental health concepts all within the same notebook, so it'll make our studying easier later on. Okay. So let's move on to the next question.
I think we had some questions on this one first.
Oh, yeah.
So first, I did want to mention what Holly said about the educational objective here. These are great little summaries for your studying, like how she put that in the notebook. Great ways to condense your learning and your knowledge of what you need on something. But with that, we did have a question. Some students were curious about option 2, if we want to scroll back up, and why that was correct in terms of checking for what's in their mouth and all that. So do you mind explaining that one a little more?
Yeah, so one of the major concerns with the client who has active suicidal ideation is the possibility of them cheeking or hoarding their medication in order that they could either save the medication after the nurse relieves the room in an attempt to overdose later, or that they might try to potentially choke on the medication. But it's very important, if you have a client who has active suicidal ideation, just to make sure that they do swallow all their meds and that you see them do that before you leave the room.
How would the nurse perform that check? Do you have
depending on the client's age, that can vary. If it's a child, you might need to have them open their mouth and kind of like look in each of their cheeks. And also it depends on the level of the client's suicidal ideation. For clients who are severely suicidal, then you might have to be able to perform a mouth check, just checking each cheek and just making sure to look under the tongue that they haven't hidden any medication.
Yeah. And you could definitely, if you want to, use like a tongue depressor or like a pen light or different things to help see a little better, as long as you know you're keeping them safe. So.
And always gloved hands first.
Yes. All right, that looks like our only question we really had for that one. So let's hop on to the next one.
Awesome. So our next question is, a nurse is caring for a 10-year-old client diagnosed with attention deficit hyperactivity disorder. And for this question, we're looking for what complication is the client at risk for. So with psychosocial integrity, one of the key concepts that we're looking at is the ability of the client to be able to cope with their illness. A test-taking strategy for this one is for questions that have risk for as part of the question stem. We want to look at what is being asked about the risk for. So for this one, it's ADHD. So our options are delayed physical development, intrusive thoughts, low self-esteem, or paranoia. So you guys can answer in the box here.
So we've got the poll for you guys up if you want to actually answer in that way for me. And we'll give you a second to do that before we go. All right, it looks like most of our viewers are choosing option 3, low self-esteem.
Let's see if you're right. Yes, good job. Woo. So this table is really nice as it kind of consolidates the information about the clinical features of attention deficit hyperactivity disorder, or ADHD. So something that many people don't understand with ADHD is that it can occur in all ages. So it might be something that you see in your colleagues, in your family members, maybe in yourself, or even in your clients, no matter their age, not just in children. Something else with ADHD that a lot of people don't think about right away is that it's not just hyperactive or restless symptoms like fidgeting or interrupting others, but it can also be inattentive symptoms, which might look like difficulty focusing, being distractible, or being forgetful. Something else that's important is the symptoms first have to present before a client is 12, and then they must occur in 2 different settings. So that could be like work or school or home. And like we said before, they also are going to be able to cause a functional impairment. So we're looking for all those things when we're thinking a client has ADHD. And so for this question, we chose low self-esteem. And so the reason for this is sometimes when clients have ADHD, because of the symptoms that come with ADHD, like the low frustration tolerance or irritability, or feeling like they can't meet the demands that are being placed on them because of their difficulty focusing, it may lead to impaired social skills or possible peer rejection or feelings of isolation. And this doesn't occur with everyone, but it is something that they are at risk for and that we should be looking for in those clients. ADHD is not associated with delayed physical growth. ADHD medications, such as like stimulant medications, they can cause a decreased appetite, which can affect physical growth. However, this is only if the client doesn't maintain a proper diet, and so it's not something that might happen to every client who has ADHD, but is primarily related to the medications used to treat ADHD. Intrusive thoughts or urges or impulses, those are more common with obsessive compulsive disorder, not ADHD. And then paranoia is more associated with schizophrenia and certain personality disorders. And it may be seen in clients with ADHD taking high doses of stimulants, but that's related to like medication misuse and not just taking the correct amounts of medication for ADHD. So let's go ahead and we'll take our educational objective and we'll put it in the notebook again. So we have that saved here. Okay.
So I did want to add on here, I'm going to scroll back up to the table. Something to point out, we didn't really go over, but on talking about inattentive symptoms versus the hyperactive symptoms, what you may have known as ADD or attention deficit disorder is now classified under ADHD. And so just remembering that those are not, that those are a combined diagnosis, if you will. I'll let you use the different wording on it, but that is what that term is known as now, and so that is how the diagnosis will be written, presented to you, all of those things, if you see a client with it. So I'm looking to see if we have any questions from anybody right now. Just as a reminder, this will be posted for later for you guys to watch on our nursing channel. But other than that, I don't think we have any questions right now on this one. Awesome. So, yep. The live poll we're having was just to answer this question here. Nothing else going on there. Don't worry, guys. So we'll go on to the next one.
Okay. Up next, we have a nurse caring for a client who's experiencing bulimia nervosa and then planning their plan of care. And so another issue under the psychosocial integrity topics is dealing with acute or chronic psychosocial health issues. So one of those big issues is eating disorders. And those are important because they not only impact the client's body, but the client's mind as well. And we'll see how that comes to play in a little bit. So while we're answering this question, a tip that we can offer you is to take each question as a true or false statement, and maybe add that to the tip earlier of starting at the bottom and working your way up. This way you're not only reading through the question slowly, but you're processing through each question as its own individual statement. So we'll give you a second to look at these questions here. Something else to know with Select All that apply is it might not only be 2 or 3 answer choices that are correct, there could be more and there could be less. And we'll talk about that in a second too.
All right, we'll give you guys a second. This one will just be a free response since we can't do the poll for the multiple options. All right, it looks like everybody is saying all of them.
Okay, let's see if you guys are right. And you're correct.
Yeah.
Okay, so as we mentioned just a second ago, something with Select All that apply is that these questions can have 1 correct answer, or they can even have up to all 5 answers or all 6 answers being correct. So that's an important thing to notice when you're test taking. So for this image that we're going to be looking at, this image is on bulimia nervosa. And so with bulimia, the client experiences periods of binging and purging, which binging typically looks like overeating and purging looking like using excessive use of laxatives, vomiting, or excessive exercise in order to control weight. And so with the excessive purging behaviors, especially with vomiting, we typically see a lot of physiological manifestations too, such as the hand calluses or the Russell sign that comes from inducing vomiting, cardiac arrhythmias, which we'll talk about in a little bit, oral changes such as problems with dental erosions, and many other things that come along with this. So it's important when caring for these clients that we monitor not only their psychological well-being, but their physiological self as well. So as we talked about, bulimia nervosa is a compensatory behavior, which means that a lot of times clients are trying to control things in their life, whether that be life situations or controlling their weight. And they feel like that their diet or that how they're eating and how they're controlling their weight is a way that they can make themselves feel better. So something that a nurse caring for a client with bulimia nervosa should be looking for is assessing the client's readiness for change. So if a client is experiencing purging behaviors, are they willing to stop those behaviors, or are they still at a point where they are comfortable with them and don't want to change? As sometimes they might not be aware of the consequences of their behaviors, like how it's impacting their body physiologically. Another one is to designate a staff member to monitor the client before, during, and after meals. Usually this needs to be at least 30 minutes, if not an hour after the meal, just to prevent purging behaviors such as the client going to vomit the food up or hiding food, which might be used to binge later on. Next, encouraging the client to journal about feelings associated with food is important so that the client has the ability to understand more of the relationship that they have with food and the feelings and emotions that might contribute to those maladaptive eating patterns. With all mental illness, it's important to question the why behind the behavior, as we have to be able to know what is causing the behavior itself in order to get the behavior to change. So that's really important to think about no matter what the diagnosis is. Next is initiating a structured meal schedule. This will just help the client from binging on food throughout the day and feeling guilty afterwards. So maybe just making sure that they know that they're going to have breakfast, lunch, dinner, and maybe 2 snacks in between, or however that looks. And then we know to be able to monitor for their food intake during that time as well. Lastly, we have monitoring for signs of electrolyte imbalances, as a lot of times with clients experiencing purging behaviors like vomiting, they may result in hypokalemia, which can also impact cardiac arrhythmias, which you can kind of talk on.
As someone who works in the cardiac world, obviously, I'm going to encounter clients that are dealing with different mental health diagnoses and different things like that, and so I need to be aware of that in my world working, and vice versa. You need to be aware for your, and so, the electrolytes are super important when we get into, like we said, cardiac arrhythmias, but also just even, like can be having muscle cramps, you could be having brain fog, different things, all from that. And so kind of keeping that whole patient in mind and not just, when you're working in an inpatient psychiatric unit, thinking about the mind, and when you're working in a cardiac unit, just thinking about the heart, but really trying to always keep that big picture together can definitely be a really helpful thing. And so this is a great example of how we connect different things. And I really love what you're saying about figuring out the cause or getting to the root of the client having the maladaptive eating patterns or behaviors. Obviously, as a nurse, it's not our job to get to a diagnosis or anything like that. But I think when we're caring for clients, it can really help us understanding the emotions and why someone is struggling with something, be it, bulimia, or be it they've got another diagnosis that they're stressed about or, having a hard time with, and just really taking the time to understand them, I think can make such a difference. And that's not an NCLEX tip, that's just being a nurse tip. But I'll let you read the educational objective, and then it looks like we have a question, or kind of a common question, but if you guys have more, feel free to leave them. So
we'll put this into our notebook.
Mm-hmm. And what's awesome too is we can put the image in here as well if we'd like. We're taking our time to load. We may. If it's taking too long to load, we can always. We'll try it one more time. Sometimes it just takes a little bit to load, and if not, that's okay. You want to see if it'll let us add the image?
Yeah, let's try that
image. So I love all our images here at UWorld. We'll talk about some more in a little bit. Oh, goodness, we're slow. These are made in-house by our own illustrators, by our own graphics team, and so these are not going to be images you'll find anywhere else. All of the tables, like you've seen in the other questions, we make those as well. And, all of the teams work together and have input to make those. And so it's a pretty cool thing that we get to make those and have that content for us. So I'm going to go ahead and we kind of have a couple questions here regarding SATA. You want to scroll up to the top of the explanation. So if you look right here, this part right here, sorry. So as of 2017, SATAs, or select all that apply, on NCLEX can include any number of correct responses. So this could be 1, 2, 3, 4, 5, if it's a 6-option 6. They're never going to be 0, because then there would be none of them. But UWorld has worked to be as close to the NCLEX as possible, and so we have that change mirrored. I think we had a select all that apply with 6 options in one of our previous weeks, and then this one is all correct. And so, it's obviously not going to be the most common thing to have all correct, but do know that that is a potential to have for all your correct options. And again, you could have something with only 1 correct. And so, and
sometimes it can feel scary to select everything
Definitely.
in a select all that apply, but by using that test taking tip we talked about, like treating each one like a true or false statement, if they all are true, then it's something that can give you confidence in selecting all of them.
Mm-hmm. And it looks like we've also put in the chat on a link to the NCSBN's website, and that is who makes the NCLEX, makes the test plan. We talk about all of those things. There's a link that's been put in the chat on how to respond to questions on the NCLEX, and what your options are and what that looks like. So I would encourage you guys after this to look at that, as well as some of the FAQs that they've also just linked in there. So I think we are going to move on to our 4th question. So this will be our last one for the day. We'll go through this, and then we will take your questions after, like we said, on nursing topics or anything specific from today, any of that. So kind of start thinking about them, and we'll review those after. But if you want to go ahead and start on the next question.
Yeah, so this question is about intimate partner violence, and it's an important topic that unfortunately is becoming more and more seen in the clinical practice. Something important when looking at psychosocial questions, one of the points on the NCLEX-PN plan is to recognize nonverbal cues to physical and psychological stressors. So in this question, the client does report abuse. However, there are a lot of times within the clinical setting that you might encounter a patient who may have signs of abuse without actually reporting the abuse themselves. So it's important to treat each patient with empathy, to ask open-ended questions when you're caring for a client, and to trust your gut instinct. And if you feel like there's a patient who might be suffering from a hard situation, maybe taking time to look into that a little bit further. And so going into this question, we are looking at appropriate interventions for a client who has reported abuse from her spouse but is not ready to leave the relationship. And so another test-taking tip is to read the question stem, and for longer stems such as this one, summarizing it down to what the answer is, or what the question is actually looking for. So for this one, we're looking at a client who's being abused by her spouse but is not ready to leave, and what interventions would be appropriate for this client.
So we'll let you guys answer. As a reminder, keep the video quality at least 720p for us so we can make sure you're seeing everything. We're nice and zoomed in. And if not, go ahead and refresh the page and that there. So we are getting our options in. I'm seeing a good combination. Looks like the most common I'm seeing is 2, 3, and 4.
Okay, let's see if you guys are correct. And you got it right. We have a smart group today.
Yeah,
Holly.
we do. You guys are 4 for 4.
Okay, so for this topic, like we talked about before, intimate partner violence, it's a form of violence that can incorporate all types of abuse: physical, emotional, verbal, sexual, and sometimes even economical. It's something where power is being inflicted by one partner against another in an intimate relationship in order to gain power and control. And so a nurse working with survivors of intimate partner violence need to make sure to have the client's safety at the forefront of their mind. With all these mental health topics that we've discussed, safety is always the priority, as with mental illness, it's usually an ever-changing landscape of if the client is safe or not, and so it's important to continually assess this. So for this question, we're going to assess the client for thoughts of self-harm, as many times clients may think that suicide may be the only way out of their relationship. And even though this is hard to think about, it is something that can happen, and so we need to make sure that we're assessing for the client's safety at every interaction that we have with them. The next one is collaborating with the healthcare team to develop a safety plan, which in this case, the safety plan is making sure that they have a secure location and an emergency kit with essential items in it, things that if the situation escalated with their partner and they felt like they were in a place where they were unsafe, they could go to this place and they'd have the items that they need. And this just facilitates an easier transition when these hard situations occur, and helps benefit them and their safety in the future. Next, we're going to follow the facility guidelines in reporting and documenting, just gathering evidence, whether that looks like photographing the injuries themselves or documenting them on a body map. These things are really important for legal proceedings. It's important to have not only the subjective data of what the client's saying, but the objective data as well, such as the pictures or the body map. These are usually taken on a special camera that the hospital has, and so it's important to look at your facility guidelines if you do encounter a client who has gone through abuse.
Definitely. And, you know, from my perspective as someone who is always looking at perfusion, looking at all those different things, knowing about injuries in different places or different things can be really helpful, especially if they're not super visible on the skin. Because if there was something traumatic over an organ and there is bleeding happening, or if there's an open wound and there's some sort of infection that generates, just from a practical, and safe nursing stance, we want to make sure we're treating those injuries as much as we can, But like you said, also all the more, if there was to be any legal proceedings that occur, should this client leave their spouse, then we want to make sure that we've done everything on our end to really take care of that and cover the documentation thoroughly, and really take care of the client as much as we can, and help make that part of it not the intimidating part, and let us be the ones to help them there. So.
Definitely. So with our incorrect answers we see here, identifying which client behaviors trigger the abuse would not be a correct answer, as this places the blame on the client rather than the abuser. The client is never responsible for the abuse that's happened to them, and that's why, again, it's important to think about therapeutic language when you're talking with the client and using open-ended, empathetic questions. Next, unless the client has expressed a desire to leave the relationship that they're currently in, you would not advise them to live with the relative, as this is an appropriate intervention and they need to come to the point of making this choice for themselves. And it is important, though, however, to have that safety plan in place, making sure that they have a safe location that they could go to if things do escalate.
And I think kind of a helpful just test-taking one here, looking at options 1 and 5, any answer choice on a question that is going to put any blame or any wrongdoing onto the client is not really going to be a correct answer. I don't think any of the time. We never want to, one, just because it's incorrect, we're not going to blame a client, but also it is just not therapeutic at all. And so we never will have a correct answer that is going to place the blame on the client in any way for abuse. And same with option 5, we're never going to, we're not going to push them to do things that are out of their comfort zone, that are inappropriate. We are going to work with them to be at a level that is good for them and that makes them feel the safest and gives them the most autonomy over what they're doing. So
definitely.
All right, so we got our educational objective here. We covered it pretty well, but I'll let you, if you want to read over it.
So our educational objective is, again, intimate partner violence is an abusive behavior inflicted by one partner against the other. So interventions, again, for a client who is a survivor of intimate partner violence includes developing that safety plan, making sure that they have the safe location and emergency items available, assessing them for self-harm or suicidal ideation, and obtaining and documenting evidence of injuries that they might have.
So I had someone asking if we could show the option for number 1, or option 1, excuse me, again. So option 1 was advising the client to avoid triggering the spouse's behavior. And so again, that would not be therapeutic at all, and that would be placing blame onto the client for the behavior, and we do not want to do that. So I hope that answers your question.
And that's something else with the psychosocial questions, are thinking about if the question is something that's therapeutic or non-therapeutic to the client is a good way to also kind of filter through these and to tell you if the answer is correct or if it's not.
So if you guys have any other questions on this one, you're welcome. On this one particularly, you can leave it for us. If not, you can go ahead and ask some of your general questions, and we will start answering those in just a minute. I think Holly's going to go back over some of the study tips that we talked about today, and we're also going to show you guys an image as well after we go through those study tips.
So again, today we talked about when we're looking at select all apply questions, specifically, we're going to answer them from the bottom to the top in order to slow ourselves down and look at each answer choice. With select all apply questions, we're also going to treat each one as a true or false question, and that'll help us narrow down the choices. And then with looking at a question stem, we're going to summarize the question stem and figure out what the keywords are to help us answer the question. And then along with a question asking for risk factors, figuring out what that diagnosis or disease process is in order to know what answer choice would be correct. And so like Holly mentioned, we have many new media images which are being created by UWorld every day. And so this is one that we were actually given today, which goes along with our intimate partner violence question. And so we always want to work hard to be able to demonstrate topics to our just students in
Yeah.
many different ways. And as people are visual learners, some are written, we want to be able to present everything.
We even had a student comment earlier that they're a very visual learner, and we're happy to have the pictures, so this is for you.
Exactly. So this one in particular talks about the cycle of violence. And so, like we talked about earlier, abuse is something, unfortunately, that usually is not a one and done thing, but however, it is cyclical in its manner. So generally starts with the tension building phase, where the abuser becomes irritable and maybe withdraws affection, and then the abused client may try to take the blame, like we talked about. And then next, it might turn into the battering phase, which is when they have physical abuse or economic, sexual, emotional, those things tend to happen. And they may seek help as a result or hide from the abuse. And then lastly, the honeymoon phase, where the abuser feels remorse and attempts to make the abused client feel better. And usually they accept the apology. If not, then the cycle can end and they can hopefully seek help before this phase begins. So it's kind of important to be looking for this in the clients that you're caring for, because if we can catch clients before going back into the honeymoon phase, then we can actually get them the help that they need to be able to get out of those rough situations.
Absolutely. And I love this image shows it as a cycle. Violence is not going to be lateral, especially when we look at abuse. And so to see that it does kind of have the wind up and the cool down,
Definitely.
and to see where is a place in that cycle to stop it can be really helpful. And so, yeah, I think this is great. We have a couple questions back on the one we were just on, so I'm just going to flip real quick. So we had some students asking about option 5, because we know this client is pregnant, and so in terms of her safety, can you speak a little more on why we would not be encouraging her to do that?
It's still a situation where unless the client expresses a desire to leave the relationship, we can recommend that they have a place that they could go if things escalate and that they could be safe, but you're not able to encourage the client directly to leave a situation and go live with someone else, because along with that it's not an easy transition. It would require them to most likely possibly put themselves into more harm even if the abuser knew where the relative was. So it's important instead to have a safe location where maybe only a few people know where the client would be at that time in order to be able to get away from that situation. Yeah. But it's also something that the client needs to be able to choose themselves, and not something that should be put on them.
Definitely. And with our test taking, we always want to, in our mental health questions or other questions, we want to encourage the client to make their own decisions, encourage autonomy. We want to let them make their decisions. And so when you see option choices, you never want to pick something that is forcing a client to do anything, even if it feels like a good option or a good thing. We're not going to force them into doing things. And so
definitely, because not only does it help them have autonomy, but it also encourages them and increases the chances of them actually following through with their care as well, which is really important.
Yes, definitely. So it looks like we have some other questions coming in. I think the first one we will start with. Someone was asking about sundowning. And I think they were asking about answering questions with it in particular, but I also think it'd be good if we want to just kind of give a good just overview in case if you're not aware of what sundowning is, or you've maybe heard it called something differently. So I'll let you know.
So sundowning is something that typically it always occurs usually in the evening or overnight hours, and is typically in clients who are suffering from Alzheimer's disease. And it's times of when they experience increased agitation or irritability. They may have some more bizarre behaviors during that time, possibly becoming violent. And this is caused by an alteration in their circadian rhythm. And interventions that might help them is to reorient them to where they are, making sure to do that gently, not just asking them direct questions of why they are confused, because that never gets anywhere, but just trying to reorient them to their surroundings and make sure that they're in a place that's safe and not causing harm to themselves or others.
Yeah, I think when you're being asked a question about sundowning on your NCLEX or anywhere else, your biggest thing is keeping that client safe. That's always going to be your biggest obstacle, but also biggest thing that you want to keep in mind when answering the question. And so, like Holly said, during the day, we want to make sure the client is moving, doing things. We don't want to let them sleep all day. We want to try to kind of, their circadian rhythms are off, so they're a little off on their schedules and timing, and that can be due to many things, but we want to make sure that we're helping them as much as we can. So, we're going to get up and go eat breakfast. We're going to go do our normal tasks. We're going to dress and do all those things. So that way the client is on somewhat of a normal schedule and is hopefully a little more tired to sleep at night. But again, if somebody is prone to getting up out of bed, doing things like that, we want to make sure we're always removing the throw rugs, keeping the lighting appropriate. We don't want to blast them with lighting, but a totally dark room is not going to be the most appropriate thing for them. We probably, if they are in an inpatient facility, we want to keep them closer to the nurse's station so we can make sure they're being monitored. We don't want to have a fall. Trying to think what else with them. What else would be important? I'm thinking maybe foods and mealtime would be important with them, keeping those strict and encouraging supplements if they're not eating. What else would you have?
Yeah, I think the biggest thing is just safety, like we talked about before. A lot of times you might see like the irritability or aggression, so it's just not overreacting in those situations, but staying calm, and if you need to, getting help. Yeah. If it does escalate.
Yeah, and I think also with these clients, or with any client experiencing confusion, especially getting delirium, any things like that, we want to keep our environment consistent. And so this could look like a continuity of care. If you can have the same nurse caring for them for multiple days, maybe keep the same, trying to keep, like I said, keep your lighting consistent, maybe keep the noise consistent, not having too many people in and out of the room. And, especially if we get to like a long-term care facility, we want to make sure our clients are on a good schedule and are doing normal things during their day. And so every day at the same time, roughly, they are doing certain tasks or eating certain meals or whatever. And so that way we can make sure they have as much structure as possible, and the less overloading they can get, like sensory-wise, stimulus-wise, the more we can help them to kind of stay calm and relaxed. And then in the evenings, if they are sundowning, we're going to work with it and do the best we can to keep the client safe, but also you as the nurse stay safe. Like Holly said, if they do get any sort of combative or fearful. So that's a great question. I know you really want us to answer that one, so sorry for making you wait on that. I'll answer one that we got. Somebody wanted to know after they take their NCLEX if they can review their results. So if you pass, you're just going to know you passed. If you do not pass your NCLEX, you will receive a score report. I think we put a link in the chat discussing this a little bit, but this score report will break down your the test plan categories for you and what you did well in and what you did not do well in. And so I would advise, if you do not pass your NCLEX on the first try, really use that candidate score report, because that's going to be a pretty invaluable tool to tell you exactly what you need to work on. So,
and like we talked about earlier, at the bottom of the questions, you guys were able to see the psychosocial integrity label here.
I think it's the very bottom. And in our bank, these are going to be under, I believe it's mental health concepts. And so any psychosocial integrity question will pretty much be there. You may see some crossover here and there with other categories, but for the most part, they will be in that one.
But as you get your score report too, this is important since it should give you categories of what topics that you might need most help on. So you'll be able to sort that in our bank too and see what questions you might need.
Yes, and excuse me, it was called the candidate performance report, not the score report, just FYI if you're looking for that online. So somebody else asked, and we'll both answer on this one, if we are both practicing nurses or if we just work for UWorld. The answer is yes. So I work in the cardiovascular ICU, mostly with open heart surgery patients, and post-op. We do all sorts of other stuff too, but that's kind of the fun one. And I still work there a couple times a month, and then I'm here as well, so I get to use that experience. And Holly's got some kind of different experience. I'll let her tell you about her experience in school.
I'm currently doing my clinical practice, training to be a psychiatric nurse practitioner. So I'm working in an adult outpatient clinic currently, and have been able to rotate throughout the community into different mental health settings.
Yes, and prior to that, she, like she said, worked in pediatric inpatient psychiatric unit. Sorry, that's a mouthful. So she's got kind of a unique experience there to talk about a couple different things. So. It looks like we had another question, and you guys can keep these coming. We've got plenty of time. So somebody was asking how to approach UWorld when reviewing for the NCLEX. They said there's different ways, but what did you think is best to start with? So I would say this depends on what subscription you have. I would definitely recommend buying the subscription that has those 2 self-assessments. Like I mentioned last week, those are items that are not anywhere else in the UWorld Q Bank or in our, all of our questions. And we've picked those questions to match the breakdown on the test plan. So kind of how today we said this is between 6 and 12% of your NCLEX. We're going to have the self-assessment, those 100 questions, mimic that in their breakdown. And so that can be a pretty good indicator of how you'll perform on the NCLEX because it is so similar in nature. So I would start with one of those when you are first starting your studying to give yourself kind of a baseline. You can see in there what categories you need to work on, what you did well on, and just overall get a good starting point. And then from there, we've got some resources on our website and on the blog of how to make a study plan, all those things, and deciding what for you works in terms of how many questions per day. Are you going to be strictly going through questions? Are you going to do them in the tutor mode where you can see the rationales? Are you going to do the test after? And then I would suggest like about a week or so before, what would you say, for the second self-assessment to kind of get a gauge of where you are, what you really need to focus on at the last minute, and then from there, going with that. I always tell everybody when you get closer to testing, go through the bank in your items that you have gotten wrong, your incorrect items, and just make tests out of those and go back through them. You can do it that way, or I think I can show you as well. I had in this test here from last week.
Well, and Holly, sometimes those percentages are kind of scary at the end where
Definitely.
it says that you only have like a 69% chance of passing. Like, what does that mean?
So with that, when you guys get those percentages, I know you love to ask about those. So do remember that, when you're on UWorld and even when you're taking your NCLEX, these are not going to be like in nursing school where you needed a 75% or you needed whatever score to pass. For lack of a better term, for kind of an oversimplification, the NCLEX is 50% either way. So once you pass that, once you have more than half correct, again, this is a very simplified version of it, is the pass or fail. And so when you see that you only have 60-something% on UWorld, like don't freak out at that. That's actually a pretty good score because you are well within what you need to get that. And so, like I was saying with the choosing your incorrect options to take quizzes over, and then last week we touched on this too, but again, this is our fun little test account, so I'm not doing too hot here. But if you go to your reports, this is something that I really like. We can look at our different categories here, and within child health, we can see exactly how many questions we've gotten correct, incorrect, all of that, and let this really help you, especially as you get further into your studying, see what categories you're doing, better or worse in, and then kind of focus on that. Because if you are scoring 90% in one category and 40 in another, probably take a break on that 90% one and go on. So let's see, what else do we have? I think some more categories questions. I'm sorry, I've got y'all's questions down here too, so I'm peeking. Somebody also wanted to know, do we advise to review or study the day before exam?
I can answer that one.
Please do.
So something I like to recommend to nursing students is the day before your exam, take the day off. So do something that might rejuvenate yourself, whether that's just spending some time with family or friends, going to get a massage, hanging out outside, whatever refuels you. At this point, you've studied all that you can, and so it's important just to find peace and confidence in the fact that you have studied all this material and you're ready to take this test.
Yeah, and I'd say with that too, kind of just adding on, try to get some good sleep the night before. I know I looked up, I took my NCLEX at like 6 p.m., so I went home and took a nap. But if you've got an early morning testing time, try to get to bed at a good time and not be rushing to go to bed in stress. Lay your clothes out the night before. A great tip I've heard is go do a drive-by of your testing center a couple days before, just so you have an idea of where you're going, what's going to happen. Make sure you've read all the rules pretty thoroughly, just because they can be a little picky on what you can have and not have. And just show up ready to test, eat a little bit. You don't want a rumbly stomach the whole time, but maybe not too much. But just take it easy that day before. I guess it's nice to have our mental health nurses here to help us with that one, but just kind of rest and be proud of yourself for your hard work in school. I mean, you graduated, made it this far, and studied, and go take your test and go crush it. So, we've got some questions about live streams again. We will at the end mention, but we do have at least a couple more weeks for now, and we'll tell you about those topics in a little bit, but just so you know, that is coming. You are accepting, yes, we are sending all the positive vibes your way. You are welcome there. We've been there, so
Yes.
yes,
You can do it.
Someone said they learned more than our 2 years from nursing school. Oh, more with UWorld, so. All right, well, I think it looks like that's about all the questions that we have for today. As always, if you guys have questions, send them in on our Instagram. You guys can comment here. We try to comment back on YouTube if you've got questions specifically about disease process, any of that, give you a little answer. But other than that, I think we're pretty much good. So let's look. You went over your test taking tips earlier, and we've got that. So
I think maybe talking about your subscriptions.
yeah, if you want to, I can remind them there. So don't forget, UWorld has those 30, 60, and 90-day subscriptions if you guys are getting close to your test date. I know I saw some of you said, you're testing the next week or two, so make sure you really get that good studying in. And if you are newer to nursing school, about to start, or just somewhere kind of in the middle, we do have those subscriptions up to 2 years, and we've got options with the self-assessment. We also have some options you can buy where you can reset your QBank in the middle of your subscription. So if you want to go through it all again, you can do that. And like I said, we just really suggest those. The 30-day subscription can be great to just get that really last-minute kind of studying in. But with that, would you like to remind them about next week?
Yeah, so next week, like we said, we're going to have another live review session coming for you on YouTube. Our next NCLEX live review will be over pharmacological questions. So we look forward to speaking with you guys then.
We'll be talking about all of your farm items, all your interactions, all the different things.
Should be fun.
Yeah, come ready with your questions for us. Again, we're on YouTube, Instagram, Facebook, all of that. Reach out to us, and we will always try to get back with you. So with that, I think that's all we've got for today. So until next week, happy studying. Bye.
Bye.